Ever struggled with a UTI and looking for natural remedies at home? Look no further. In this video, we'll share effective ways to treat urinary tract infections. Say goodbye to discomfort and hello to relief. Number 8. Stay hydrated. Staying well hydrated is a crucial aspect of managing a urinary tract infection. Drinking an ample amount of water helps to increase the frequency of urination, which, in turn, flushes out bacteria from the urinary tract. By diluting the urine, water can also reduce the concentration of potentially harmful substances that might irritate the bladder and worsen UTI symptoms. Furthermore, hydration aids in maintaining the overall health of the urinary system, promoting proper kidney function, and supporting the body's natural ability to fight off infections. However, it's essential to balance fluid intake and not overhydrate, as excessive consumption can lead to discomfort and strain on the kidneys. Number 7. Urinate regularly. Urinating regularly is a simple yet effective practice for managing urinary tract infections. When you urinate frequently, it helps to expel bacteria from the urinary tract before they have a chance to multiply and cause further infection. Holding in urine for prolonged periods can allow bacteria to linger in the bladder and urethra, leading to increased inflammation and discomfort. Additionally, regular urination helps to flush out any irritants or toxins that may have accumulated in the bladder, promoting a healthier environment for the urinary tract to heal. If you feel the urge to urinate, it's crucial to respond promptly and not delay or suppress the need. Number 6. Cranberry Juice. Cranberry juice has long been considered a popular natural remedy for preventing and managing urinary tract infections. It contains compounds called proanthocyanidins, which are believed to help prevent bacteria, particularly E. coli, from adhering to the walls of the urinary tract, thus reducing the risk of infection. Additionally, cranberry juice is rich in antioxidants and vitamin C, which can support the immune system's ability to combat infections. While some studies have shown promising results in preventing UTIs, the evidence regarding its effectiveness in treating existing UTIs is less clear. Drinking unsweetened cranberry juice might be beneficial as part of an overall UTI management plan, but it should not be considered a standalone treatment. It's essential to consume pure cranberry juice without added sugars or artificial sweeteners, as these can exacerbate UTI symptoms. Number 5. Probiotics. Probiotics have gained attention for their potential role in promoting urinary tract health. These beneficial bacteria can help maintain a balanced microbial environment in the gut and urinary tract, which may aid in preventing and managing UTIs. Probiotics work by supporting the growth of good bacteria and inhibiting the growth of harmful bacteria that could cause infections. Lactobacillus species, in particular, are commonly found in the urinary tract and are believed to play a protective role. Probiotics can be obtained through certain foods such as yogurt, kefir, sauerkraut, kimchi, and other fermented products. Additionally, probiotic supplements are available, but it's essential to choose a product with strains known to be beneficial for urinary tract health. While probiotics can be a helpful addition to UTI management, they should not be used as a substitute for medical treatment. Number 4. Avoid irritants. Avoiding potential irritants is an important aspect of managing urinary tract infections and reducing discomfort. Certain foods and beverages can irritate the urinary tract, exacerbating UTI symptoms and making the condition more uncomfortable. Some common irritants to avoid include caffeine, alcohol, spicy foods, and acidic foods. Caffeine and alcohol can act as diuretics, leading to increased urine production, which may worsen the frequent urination and urgency associated with UTIs. Spicy and acidic foods can irritate the bladder and urethra, causing burning sensations and discomfort during urination. By eliminating or reducing the consumption of these irritants, individuals with UTIs may experience reduced inflammation and less irritation in the urinary tract, making it easier for the body to heal. Number 3. Warm compress. Using a warm compress can be a soothing and effective way to alleviate discomfort associated with a urinary tract infection. The warmth from the compress can help to relax the muscles in the lower abdomen and reduce the intensity of pelvic pain or cramping. Additionally, the heat can increase blood flow to the affected area, which may aid in reducing inflammation. Applying a warm compress over the bladder region can also provide a sense of relief and comfort during urination, as it can help ease the burning sensation often experienced with UTIs. However, it's essential to use the warm compress safely and avoid applying excessive heat that could lead to burns or skin irritation. You can make a warm compress by soaking a clean cloth in warm, not hot, water and then gently applying it to the lower abdomen. Number 2. Pain relievers. Over-the-counter pain relievers can provide relief from the discomfort and pain associated with urinary tract infections. Medications such as ibuprofen and acetaminophen can help reduce inflammation and alleviate the pain and fever that often accompany UTIs. These pain relievers work by blocking the production of prostaglandins, which are responsible for promoting inflammation and pain. However, it's important to follow the recommended dosage and guidelines provided by the manufacturer or a healthcare professional. Additionally, pain relievers should not be used as a substitute for medical treatment. While they can provide temporary relief, they do not address the underlying infection. If you suspect you have a UTI or are experiencing persistent symptoms, it's crucial to seek medical attention for proper diagnosis and treatment. Number 1. Hygiene. Maintaining proper hygiene is essential for managing and preventing urinary tract infections. Practicing good hygiene habits can help reduce the risk of introducing harmful bacteria into the urinary tract. When using the restroom, always remember to wipe from front to back after urination or bowel movements. This helps prevent the transfer of bacteria from the anal area to the urethra, which is a common cause of UTIs in women. It's also essential to wash your genital area daily with mild soap and water, and to avoid using harsh or scented products that may irritate the urethra. After sexual activity, it's advisable to urinate to help flush out any bacteria that may have entered the urinary tract during intercourse. Additionally, wearing breathable cotton underwear and avoiding tight-fitting clothing can help promote better airflow and reduce moisture in the genital area, which may create an environment conducive to bacterial growth. Thank you for watching our video on natural and effective ways to treat urinary tract infections at home. We hope you found these remedies helpful and informative. If you have any questions or other home remedies that have worked for you, please share them in the comments below. Remember, while these home treatments can provide relief, it's essential to consult a healthcare professional for a proper diagnosis and personalized care. If you enjoyed this video and found it valuable, don't forget to give it a thumbs up and subscribe to our channel for more health and wellness content. Stay healthy and take care. See you in the next video.